Hi everybody, I am Dr. Suresh Khanna, Professor of Biochemistry. Today I am coming to talk about the COVID-19 disease, the fast spreading disease, and the test to be conducted to make confirm whether the disease is infected or not. Before entering into that, let us recall the information what we gathered from the practitioners and doctors. The very first question is, what are the symptoms of coronavirus disease? Common symptom of corona-19 or fever, tiredness, dry cough. Some patients may have aches, pains, nasal congestion, runny nose, sore throat or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but not develop any symptom and don't feel unwell. Most people, about 80%, recover from the disease without needing any special treatment. Next question is, we are coming here to the voice. That is, should coronavirus disease patients to be isolated in the hospital or not? As per the doctor's advice and practitioner advices, mainly the WHO advices, the World Health Organization, that are confirmed cases, even mild cases, should be isolated in health facilities to prevent transmission and provide adequate care. Another question is headache a symptom of corona disease or not? The virus can cause a range of symptoms ranging from mild illness to pneumonia. Symptoms of disease are fever, cough, sore throat and headaches. So then another thing, we are coming to the final point, that is, what is the recovery time of the coronavirus disease? Using available preliminary data, the median time from onset to clinical recovery from mild cases is approximately 2 weeks and is 3 to 6 weeks for patients with severe or critical diseases. So, who is at risk of coronavirus? The virus that causes COVID-19 infect people of all ages. However, evidence of date suggests that two groups of people are at high risk of getting severe COVID-19 disease. These are older people, that is, people older than or 60 years, like that. Those with underlying medical conditions such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer. The risk of severe disease gradually increases with age, starting from around 40 years. Now I am coming to my field. What are the tests to be conducted and what are the tests are falling in India to make confirm the test of the corona disease? The very first disease we are telling about the antibody test. The second test we are calling here RT-PCR test. So let us discuss about the antibody test. What is antibody test? Antibody test, also known as serological test, are used to find out the presence of virus in the body. This method of testing, blood samples are used to find antibodies. This process also detects the quantity of antibody that are produced by the immune system. It is an indirect method of testing as it cannot find the virus, but it can determine if the immune system has encountered it. Antibodies can show up between 9 to 20 days or 28 days after the infection has set in. By this time, an infected person can spread the disease if not isolated. The next question is, what is RT-PCR test? The RT-PCR test is a method of testing by taking a nasal throat swab from the patient. Also extracting the ribonucleic acid, or as we are simply saying as RNA, which is the genetic material of the virus. If it shares the same genetic sequence as SARS, COVID-19 virus, then it is deemed positive. These forms of testing can turn negative only if the actual sample does not carry the virus or it was not administered properly. The RT-PCR technology is a fairly expensive method. It requires RNA extracting machines, a laboratory, trained technicians, A minimum of 30 samples are needed to take it economically viable. Sometimes it can even take up to 4 hours to test the presence of virus on one batch. The cost of chemicals or importing elements required for the test is also high. One test can cost a minimum of 4,500 rupees. So, these are the tests we are conducted to make the virus infected or not. So, we don't want to afraid, but beware of fast spreading disease. Wherever you go, use mask. Avoid touching the peoples. Use sanitizer in necessary places. Then you will get good lifespan. Have a nice day. Don't fear about the corona disease. These diseases are like other diseases. So if we run, we cannot do anything. Have a nice day. Thank you.